All right, we're gonna get things started. So, everybody, welcome to the New Jersey Safety and Health Outcomes Data Dashboard, an equitable approach to identifying the need for Vision Zero efforts. A couple of reminders before I turn the time over to our speaker. Please make sure that you have your phones and portable devices silenced. Another thing we have are session evaluations, so just make sure that you complete those at the end of any sessions that you take. Every completed evaluation enters you into a daily raffle. So the more evaluations you put in, the more chance you have to win. There will be a QR code for the evaluations on the last slide of each section, as well as on the at-a-glance agenda, in the conference bag, and table 10 in the barn. So you should be able to find them in lots of different places. So with that being said, we are going to introduce our speaker here. So we have Christine Metzger here. Dr. Christine Metzger leads the development of the New Jersey Safety and Health Outcomes Center for Integrated Data, including establishing traffic safety and injury metrics for the New Jersey Safety and Health Outcomes Data Dashboard, and creating a website that is useful in helping to reduce transportation-related injuries and deaths in New Jersey. She is an epidemiologist with over 20 years of experience in analyses of public health data with a focus on large administrative data sets. Okay, so we'll turn the time over to you.
Well, thank you for having me here. As mentioned, I am Christine Metzger, and I'm the director of the New Jersey Safety and Health Outcomes, or NJ-SHO for short, Center for Integrated Data. And we are a program within the Center for Injury Research and Prevention at the Children's Hospital of Philadelphia. And I'll really be talking about the data at the heart of our center. This is the NJ-SHO data warehouse, and our efforts to facilitate its use for injury and transportation safety research, and to help identify needs for Vision Zero efforts. So last May, we launched our website, the public face of the NJ-SHO Center, and that can be found at njsho.chop.edu. The website includes information about the center and about the team behind it, plus information about the research that we've conducted. We have several pages dedicated to describing our comprehensive integrated data warehouse, and including technical documentation that describes how we created it. We have a section in which you can explore different traffic safety topics, including transportation safety in my community and transportation equity. We also have a page for the data dashboard, which I'll talk a little bit more about. So we've been working on integrating transportation safety data in New Jersey for over a decade. We are not alone in the desire to integrate and share this type of data. There have been increasing calls to do this from both the federal and state transportation agencies. The Centers for Disease Control and Prevention have issued calls to link non-fatal crash data to use as a public health surveillance tool. Additionally, the Safe System approach and Road to Zero strategies both call for using data-driven and evidence-based approaches to reduce injuries and deaths from crashes. So our team, led by the principal investigator, Dr. Ali Curry, began developing the NJ-SHO data warehouse back in 2010. We first linked crash and licensing data for an evaluation of New Jersey's graduated driver's licensing program. And this was the first time that researchers were able to account for the type of license and the length of time the driver had it when looking at crash risk. After that first research project, we expanded our interest into looking at other traffic safety outcomes for young drivers by incorporating traffic citation information and pediatric electronic health records. We then began to assess traffic safety outcomes across the lifespan by linking data on hospital discharges, births, deaths, and Medicare billing charges. And because we have geocoded location of both the crash and where the crash involved individual lives, we can include community measures to evaluate transportation vulnerabilities among residents of different communities. We will soon integrate data from EMS calls and from the state trauma registry. And so with all of these data linked at an individual level, we've been able to conduct numerous novel and innovative research studies. There's so much data here that we really want to expand our research portfolio by working with others, and we're really dedicated to collaborating and sharing these important data with safety partners. So this infographic depicts our comprehensive integrated data warehouse, which is again really the backbone of the NJ-SHO Center. It includes linked data from multiple statewide administrative and healthcare data sets, including crash records, licensing data, traffic citations, hospital discharges, birth and death certificates. The warehouse includes 124 million records on 24 million people over a 17-year period. Our research has thus far resulted in 42 publications in peer-reviewed journals. The primary goals of the NJ-SHO Center are, one, to encourage data use and data sharing among stakeholders to support safe transport, and two, to share information with others interested in public health and traffic safety in order to support those goals. So we've taken a data-based approach and developed a strategy to raise awareness about these data and to share the data with others. These goals support the implementation of effective community-level solutions. Our data can help communities follow this the process that's shown here. First, we can assess and reassess the traffic safety landscape to describe critical transportation issues. Second, we can locate specific communities and groups within the communities that would benefit most from countermeasures that address those issues. Third, we can allocate countermeasures in those identified communities, and then we can evaluate the effectiveness of those allocated countermeasures. This iterative process requires the availability of a comprehensive data source like that we have with relevant data at both the individual and community level. And one that can directly inform governmental transportation agencies and their community partners. The Vision Zero strategy emphasizes the need for innovative and bold approaches, and particularly those that are focused on equitable distribution of evidence-based countermeasures. We want to make sure to prioritize effective solutions in communities that will benefit from them the most. So our data warehouse has several unique features that make it useful for injury research in general and transportation safety priorities in particular. First, we have detailed data on individuals. Again, their licensing history, medical history, and crash involvement, as well as demographic characteristics not usually available with transportation data, such as race and ethnicity. We also have detailed injury data from linked electronic health records and hospital discharge data. We can identify residential communities of crash-involved individuals and have also incorporated equity measures in the community and individual level. So before I talk about each of these features, I want to give an overview of our data dashboard, which is a free, publicly accessible resource embedded in our website that features data from the data warehouse. We built it to really highlight the unique features of our data. And here's an image of the homepage, which is the traffic safety overview. It focuses on the people involved in crashes on New Jersey roads, who they are, where they live, and their experiences as road users. We show crash rates over time for the state and by county of residence. The traffic safety overview homepage is one of 10 views. The others include 2 community safety profiles, which have more detail about the different types of road users and about different driving behaviors at the community level, and 7 views that on specific safety topics, including a comparison of maps, younger and older drivers, views with different metrics for drivers, pedestrians, and bicyclists, and one for transportation equity measures. On the overview page, we present information on the total number of New Jersey drivers, pedestrians, and bicyclists involved in crashes. We also present crash rates throughout the dashboard. Driver crash rates are per 10,000 licensed drivers, and pedestrian and bicycle crash rates are per 100,000 population. We focus on crash rates to allow for easier comparison among groups with different population sizes. We allow viewers to select their residential county of interest. In this example, we have Atlantic County selected, and we compare rates for the state from the state to rates from the county for all crashes, for injury crashes, and for fatal crashes. The graph at the bottom of the middle column on the overview page compares annual crash rates among all New Jersey residents with those among residents of the county that is selected, again, Atlantic County. So most of the data in the dashboard are for the most recent 10 years of data that we have linked, 2010 to 2019. Currently, we only have data through 2019 because of the time it takes for administrative data owners to finalize their data for release. And then it also takes time for us to obtain the data and then clean, harmonize, and prepare it for linkage. And then it takes time for the actual linkage to be conducted. We are currently linking 2 more years of data through 2021, and we hope to include it on the dashboard by late spring. In the last column, we have a map of New Jersey with the crash rates for each county. For the county we've selected, again, Atlantic County, we see the rate pop up in a bright blue circle. The color gradient behind it gives you an idea of how counties compare by crash rate, with lighter colored counties having lower rates than darker colored counties. So now I'm going to go back to the unique features of the data dashboard, or the data warehouse. We were really purposeful about how we decided to integrate these data at the individual level. We linked data for all persons included in each data source with all other data sources. So as an example, we didn't limit data integration to individuals who were just in the crash data. Thus, someone who is in the hospital discharge data can link with licensing, even if they never were in a crash. Thus, although we focused on traffic safety research up until now, these data can be used for other research topics, including child injury, violence, and follow-up post-diagnoses. The linkage itself uses probabilistic and deterministic processes to identify individuals from different data sets. We don't have a single universal identifier for all people across all data sets. But we have various personal identifiable data in each data set that we can use to match records, such as first and last name, date of birth, address, and sex. This table shows the data elements that were used from each of these sources integrated into the NJ-SHO data warehouse. So ultimately, the composition of the population in the warehouse includes 58% of people who only are included in a single data source. 21% appear in 2 data sources, and 21% appear in 3 or more sources. Over half of the 24 million individuals have at least one hospital record, and nearly half have a licensing record, and more than a third appear at least once in a crash record as a driver, passenger, pedestrian, or bicyclist. Here I'm showing you the behaviors view on the data dashboard, which really highlights the perspective of the individual. In this view, we're focused on drivers involved in all crashes whose at-fault behavior contributed to the crash. An at-fault behavior includes aggressive driving or distracted driving, among other actions that led to the crash. We can compare the rates of crash-involved drivers from New Jersey to Passaic County in this example by sex, age group, and by race and ethnicity category. So motor vehicle crash reports don't always have complete information about injuries from crashes, since the responding officer can only rely on evidence from the scene and is not a healthcare provider. But because we've been able to link crash records with hospital discharge records, we can describe injuries more completely, including the extent of injuries to multiple parts of the body and their severity. So we conducted a research study that showed that there were injuries identified on the crash report that didn't show up in the hospital data. And conversely, there were injuries described in the hospital data that weren't on any crash report. So our ability to characterize injuries from multiple sources can be helpful when developing prevention and intervention efforts. And in a recently published paper from one of our colleagues, Dr. Sarton, we described how injuries documented on the crash report don't always match injuries documented in hospital discharge data among child passengers. We were able to use the hospital discharge data to more fully describe injuries to these passengers, including which body region was injured, whether there are multiple body regions involved, and the severity of each of these injuries. This view of the road user's view described crash-involved bicyclists who were injured. Again, we have rates for the state, and for this selection, Hudson County, and again by sex, age group, and race and ethnicity. We only show crash-related injuries since 2016, since that is the year that the nation switched from ICD-9 CM to ICD-10 CM codes for the hospital discharge data, and the classification of injuries improved substantially with that switch. And it wasn't a one-to-one conversion from 9 until 10. So I mentioned before that we have residential address, and we have it from multiple data sources. So we've used geocoding methodologies to identify where people live. This is in addition to knowing where the crash occurred from the crash report. So through these linked data, we can take a public health lens to describe in which communities do crash-involved individuals live. And this is in contrast to the urban planning view, which describes in which communities do crashes occur. And you may be more familiar with this perspective if you've used crash report data in the past. And so traditional use of crash report data is based on the location of the crash so that we can address dangerous intersections or road segments. And so we believe that using a public health lens and this more urban planning lens can be complementary, allowing you to create more tailored transportation countermeasures to improve safety in these communities. In our maps view of the data dashboard, we show a comparison of crash rates among vehicle occupants, pedestrians, and bicyclists who are involved in crashes and injuries in the top row, and then among those who died in the bottom row. So you can see the different patterns based on the different type of occupant or different type of road user and the different level of severity of the crash. So finally, these integrated data have given us the ability to incorporate equity measures at the community and individual level. I've already mentioned how we have residential address at the crash-involved individuals. And then from this geocoded residential address, we can identify their census tract. And from the census tract, we can classify their neighborhood according to several different geographic-based community measures. And these indicators can be useful markers for the vulnerability of certain areas to stressors such as disasters, poor infrastructure, or the lack of resources such as food, healthcare, transportation, or internet access. The two measures highlighted in blue, the SVI or Social Vulnerability Index and the CRE, the Community Resilience Estimates, are both shown in the data dashboard. So actually, I don't know how this works in Utah, but in New Jersey, the crash report does not collect information on race and ethnicity of the drivers or other road users. But since we have linked crash records to several data sources that do collect that information, including hospital discharge data, electronic health records, and birth and death records, we have been able to identify race and ethnicity for many of the crash-involved individuals. About 3/4 of drivers, for instance, link with data sources that have information about race and ethnicity. For the remaining quarter of drivers without race and ethnicity from another source, we've used an algorithm to impute this information. Very briefly, we use residential address and last name to estimate probabilities that an individual is included in 6 mutually exclusive race and ethnicity groups. Details of these methods are on our website and in a published paper. I'm also happy to talk to anybody about how we did this. We did an analysis examining the relationship of crash rates among drivers and community health indicators, or community equity measures. At the census tract level, we found that the rates of being involved in a crash and experiencing an injury in the crash, involved in a crash is the top row and injury crashes are in the bottom row. And that probability was moderately to strongly correlated with multiple equity measures. These scatter plots illustrate these relationships. note that some of the equity measures, like the Index of Concentration at the Extremes, or ICE, and the Community Opportunity Index, or COI, these are the first two columns, they are inversely correlated with crash rates, while others, such as the Social Vulnerability Index, or SVI, the CRE, and the Disadvantaged Community Index, or DCI, are all positively correlated. The direction of the correlation depends on how the equity measures are constructed, but all show that communities with more disadvantage, more disparity, more vulnerability, and less resiliency have higher rates of crashing. We can also look at the relationship in terms of comparing crash rates among groups of drivers who experience more inequities with those who experience less inequities. And so this takes into account that inverse relationship that I showed in the previous slide. The first column illustrates that drivers of minoritized race and ethnicity groups, including Hispanic and Black drivers, have higher rates of being involved in a crash than white drivers. And then the other columns, we see that regardless of the equity measure, drivers who lived in communities with least favorable equity scores were approximately twice as likely to be involved in a crash than drivers who lived in communities with most favorable equity scores. And then in an analysis examining child restraint use, we found that children in minoritized race and ethnicity groups were more likely to be inappropriately restrained based on their age and type of restraint. While only 16% of white children were inappropriately restrained, 26% of Black children and almost 25% of Hispanic children were inappropriately restrained. We took this analysis a step further and examined how inappropriate use among a particular race and ethnicity group may differ based on the community equity indicator of the neighborhood in which they live. What we found is interesting. In the areas of least equity and least resilience, which are illustrated, the first quintile of these indicators, they're the dark blue bars. The proportion of children with inappropriate CRS use was similar among Black, Hispanic, and white children. However, the differences among children living in the most equitable and most resilient areas were notable. You can see this in the fifth quintile, or the dark purple bars in the bottom. Less than 14% of white children who live in these areas were inappropriately restrained, while 18% of Hispanic children and 25% of Black children were inappropriately restrained. We present equity measures in a couple of different ways in our dashboard. In this pedestrian view, we can examine the association between the countywide pedestrian crash rate and the county's value for a couple different equity measures in this scatter plot in the corner. This graph illustrates a similar relationship as I showed earlier, with counties with higher crash rates also have lower equity scores. We also present crash rates with an equity lens in the equities tab on the dashboard. We present statewide rates for each race and ethnicity group, or you can toggle to quintiles of the community equity metrics. They're at the top left. We break it down further into rates by equity measure with age groups and with sex. We also show a map that displays county crash rates for particular demographic characteristics. In this example, we compare county crash rates among Hispanic drivers. So I've talked a little bit about some of the research that we've done over the years with these data. To find more, if you go to our website and navigate to the About and then to research papers, you can find all of the peer-reviewed publications that have used the NJ-SHO data warehouse by our research team and by the academic partners that we've worked with. Research topics include novice drivers, child passenger safety, driving with neurodiversity, pedestrian safety, driving behaviors, impacts of medications, and transportation equity. You can search by keyword, author name, research topic, or publication year.
Yes.
If you want to learn more about our data dashboard, we are offering a free training workshop at the end of May, on May 28th, about how to use our dashboard. There's a lot more detail in it than what I just gave. If you would like to join us, go to our website, again, to the About tab, and then to News and Events. And you can click on the link there, or you can type in this link directly and it'll take you to a page to sign up. So, like I said, we really would like other people to use our data as well as us. And so if you do want to use our data or want to talk with us about using our data, or if you have similar ideas about your own data, please let us know. We work really closely with interested groups to determine what data people need and how to collaborate. We operate under multiple legal and ethical agreements, including data use agreements and memorandums of use with the owners of the data that require us to keep the data secure. Additionally, our research has been approved by the Institutional Review Board, or the IRB at CHOP. We will need to establish collaborative research agreements with partners to provide guidance on how to use the data and to comply with existing agreements. We keep our data on a very secure server at CHOP with restricted access. Our analytic data sets never include personal identifiers, but research collaborators can access individual level de-identified limited data with special permissions. I can't even see the personal identifiers in these data. I mean, I could if I really wanted to, but it would take a lot. It would take a lot for me to do it because I'm not involved in the day-to-day of the linking. So if you want to work with the data, like I said, please come talk to me. Email us at NJ-SHO@chop.edu. If you're interested in, again, doing something like this, with data here in Utah or wherever you are, talk to us. We have lots of thoughts about, some of the advice on how to start, how to proceed, how to link these data. We'll set up a meeting to talk to you about what data we have and what data you may need. We are sending out a new survey soon to assess how stakeholders are using these data. Now that our website and data dashboard have been available for almost a year, we want to know how people have used it. We're also interested in what other types of information people need and want. So, of course, we have only been able to do this work with support from numerous partners and funders. The New Jersey Division of Highway Traffic Safety has provided us with substantial funding over the last couple of years to expand our research portfolio into the NJ-SHO Center, which I've really been talking about today. We've received data and support from many other federal and state government and nonprofit organizations over the years as well. I want to acknowledge the efforts of my colleagues in building the NJ-SHO Center. We're a multidisciplinary group of epidemiologists, behavioral scientists, data analysts, traffic safety specialists, and communication experts. And it's been a great experience working with this talented group of people, and we're all, especially with all of their dedication to improving transportation safety. So I think I talked really fast. I think I'm done a little early, but I really want to thank you for giving me the opportunity to talk. I can take some questions now. Again, this is my contact information, the email for the center. This QR code will take you to our website. So I really appreciate that. So.
Does anyone have any questions for Christy?
I'm kind of curious how you use that data with those different racial groups. Do you use that to help educate those different racial groups and then try to determine why those crashes occur?
Yeah, that's
at a higher rate with those different groups?
Yeah, that's a really good question. I mean, we know that race and ethnicity isn't causal. We know it's not an explanatory variable necessarily. But what it does do, the reason why those categories can be useful is it's a proxy for something. And we're not, at least in the epidemiology world and public health world, we're not good at measuring what those actual factors are that make some groups particularly minoritized race and ethnicity groups, like more at risk for crashes. And so for us, it's a tool. It's a tool to help figure out perhaps what those things are that we need to figure out, that why certain groups, why certain communities are at higher risk. So it's not a solution in and of itself at all, because we know that it's not causal. We just know that it represents something that we're still trying to figure out how to measure. The interesting thing about some of the community equity measures that we've identified, like based on where people live, is that information contains some of that same information. Like those measures contain some of the same information. It can identify some, like, it's a different facet, it's a different proxy for some of the same things that we think race and ethnicity can help describe.
So was there any additional data that support whether they were licensed or wearing seatbelts or complying with law, or was it just crash data?
So we have looked at it by different driver behaviors, and the trends are very consistent in the different communities and, in the different race and ethnicity groups. I mean, across the board, the trends are very similar. There's not, any certain behaviors or certain locations or anything like that that buck that trend, I should say. Yeah.
Do you know what proportion of the crash data has been linked, that you were able to link to a hospital data discharge? Is it your 58% of people that were linked to one data source versus 20, the other 2 or 3? Is it a higher proportion? Are you getting most of your crashes linked to a hospital data, or is it just a smaller proportion?
That's a great question. So the crash involved individuals that are indicated on the crash report that are injured. A very large majority of them we see linked with hospital data. Not all of them, because some of those people that were deemed injured on the crash report may have gone to their PCP or may have gone out of state. I mean, New Jersey is very urban, and there's close proximity to other states where people might have gone to, a different location. So we don't see all injured people on crash reports showing up in hospitals, but there is a good proportion, and I wish I knew it off the top of my head. I don't. I'm sorry. We also see hospital discharge records that have indication that someone was injured in a crash that we don't see a crash report for. And we think that there could be a couple of reasons for that. One, they may have crashed out of state. They may have crashed in Pennsylvania or New York and come into New Jersey to get medical treatment, like, later that day or the next day or something like that. Or that the crash report itself just has flawed injury data. Like, we just know that there are hidden injuries that don't show up, at the crash scene that could be, that may have been recorded by a responding officer, but that showed up later, like whiplash or internal injuries or something like that. So I hope that helps. We are linking, just a note to that, we are linking EMS data, so we're hoping that actually can help bridge some of that differences between the crash report injury designation and the hospital data, because that reflects some people who don't ever end up going to the hospital because their injuries aren't as severe. Yeah.
Can you elaborate on the question that you asked about reframing from the health perspective of what the communities look like where people versus where the crashes are occurring? What are you doing to, how is that information being taken forward in terms of looking at those actual communities?
Yeah, that's a really great question. That's something that we've just started trying to do. The funding situation out there is a little bit hairy, and so we have at least one grant application out there to do that, to do more of that research. But what we envision with that is that for the agencies that are trying to do fix roads, fix intersections that we know are high risk, to know whether or not the people that are impacted in crashes in those intersections, if they live in the community or if they don't. Like, we think that actually would be really beneficial to how the community gets communications about those road changes and those road fixes, because like if the people that are crashing an intersection or the road segment are from the area, then that could be a very different way of describing those changes to the community than if more people are coming from outside those communities. It could change, signage, it could change education, it could change media communication. And so we think that that could really be beneficial, and that kind of complements, some of those, efforts that are surrounding the actual structural changes.
And just real quick, what are some of the community indicators that you're measuring?
Based on like the roadway changes and stuff?
Yes.
So we don't have those necessarily yet. We do have an issue with data lag, and so we don't have as timely of data. Like if roadway changes are being done now, we don't have that data linked yet. We're hoping that as time goes on, we're getting faster and faster at the data linkage process. This past year was like really hard because the software system that we had previously used was unsupported, so we had to like totally change our methods on how to do that linkage. So we're hoping that when the data gets a little more timely and when we start working with specific communities about their specific countermeasures, then we can work with those communities and work with those organizations to really tailor what we're looking at as far as those community metrics evaluation with the data that we have. So we think that hopefully that'll kind of all synergize when, if we can work with communities that are doing those sorts of countermeasures.
Thank you.
Thanks.
Any last questions for Christy?
If you have more, please email me. And then I think this was the evaluation.
Perfect, yeah.
Oh,
Can we give her another big round of applause? Okay, yeah, so again, thanks to Christy for helping us out. A couple of reminders. So again, do this, the session evaluation. Again, with that, the more you do, the more chances you have in the raffle. If you need continuing credit sheets, you can visit the registration desk. But aside from that, that is all we have for you guys, so thank you.